So some of this work around mentalization has exploded as Peter Fonagy has taken this construct and put it to good use in terms of his mentalization-based treatment. So it really is one of the core features where he began, I think, with us thinking about what can create change, and then put it to good use with the borderline personality disorder patients that he's working with. So mentalizing is the key social cognitive capacity akin to language that has allowed human beings to create effective social groups. Our approach assumes that dysfunctions of mentalization not only create major relationship problems, but also lead to subjective distress, which can result in self-harm and suicidality. The close interaction between attachment processes and mentalization is the key to this. Disturbed relationships both undermined and are undermined by failures of mentalization. We therefore argue that the correction of some of these relational malfunctions can be achieved by assisting patients in the recovery of mentalizing. And so he's got longitudinal data that shows that even after 8 years following up these patients who had this mentalization-based treatment, they do better in terms of reduction in suicidality, caseness, and in terms of work and study outcomes. Because what we're wanting now to think about is preventive interventions. So Peter's been concentrating on those that perhaps didn't have the advent of having people help them earlier on. When can you come in and try and break the cycle for the next generation? So 2 places we can go. Selma Freiberg, famous paper on ghosts in the nursery, talks about how the transmission of ill health from one generation to the next. So we should be looking at the largest number of men and women who have known suffering, yet find renewal and the healing of childhood pain in the experience of bringing a child into the world. It's a very unique developmental frame in terms of when someone has a child to be able to come in and intervene. But according to Mary May, parents repeat aspects of their childhood experiences in relation to their child, as this preserves their particular state of mind with regard to attachment. So what she's saying is that we get a feeling of safety, even though it might not be optimal. If we've had insecure attachment, we see some of those features in our child and it makes for a match. And that is why we often propel in the same way, even if it's not feeling so very comfortable, because that's what we know, and those representations, it's like water going down, you know, a riverbed. That is the course, and what we're trying to do is to change that.